masks, the N95 masks, using a special UV light system. And we use UV light regularly in county government to disinfect our water supply and our wastewater and to kill viruses. So we did provide one of these units to the hospital earlier this week, and we have had requests from other healthcare providers to use the decontamination system. So the supply of PPE and the uncertainty around it remains an issue, even though, again, the county's emergency responders and the hospital are in good shape at the moment. Testing and contact tracing. Again, Frederick Health Hospital has taken the lead on testing in our community and has done a fabulous job with their drive-through operation. They continue to offer testing to people in the community, really for anyone with any symptom or a high-risk vulnerability. As of Monday, the hospital had conducted about 7,500 tests, which means about 3% of our population has been tested, and with private lab testing, that goes up to a little bit closer to 4. We have not yet ramped up testing for people who are not symptomatic, and our nursing homes are just beginning the testing that was announced by the governor a couple of weeks ago. In fact, and this is very important and something that's very local here to Frederick County, 2 of our nursing homes in Frederick County began testing of all their residents and staff just yesterday. And we do not yet have those results and probably will not have them until the beginning of next week. So there is some concern that if there is a high incident of positive tests among either residents or staff, that there could be implications to our healthcare system. If there are not enough staff, for instance, to take care of patients in a nursing home, that could create a shift of some patients to the hospital, and it could present some risk of a surge. It really only takes one major outbreak or incident in a nursing home to really create some strain. So we just don't have the data from this testing back yet. So it's a reason for us to be slow and cautious. We also need to continue to retest in our congregate settings, and in some of the congregate settings we haven't tested in yet, and we don't have the testing capacity at the current time to do that. Again, testing has been done almost entirely by the private sector, the hospital and local labs. Few people recognize or realize that the health department is an oversight and coordinating agency. It is not an agency that delivers direct health services. We have also not had state testing operations here in the county or test supplies outside of those being used in our nursing homes. Testing has largely been left to the private sector and for the locals to accomplish. The health department has done a good job with contact tracing. They are using school health, community health, and non-health professional staff in the health department in this effort. And they do follow up and track every positive case in Frederick County. They actually exceed the guidelines for the number of contact tracers in place to serve a population the size of Frederick County, with more than 100 employees dedicated to this effort. So the health department has done a good job, and they have entered a contract with NORC, and they have to ramp up contact tracing with NORC to go with an expansion of contact tracing, to go with an expansion of testing. That has not yet begun, but is scheduled to begin after Memorial Day, and our local health staff will be supporting that effort. The hospital has a plan for surge capacity, and at this time we appear to be in good place with that plan. So as you can see, we still have to ensure adequate and reliable supplies of but we have work to do to ensure adequate and reliable supplies of clinical PPE. The governor's roadmap to recovery includes stop signs, and I think a lot of people miss that. The governor's roadmap to recovery includes stop signs. If we see a spike in positive cases or a surge that overwhelms our hospitals, if we see a spike in positive cases or a surge that overwhelms our hospitals, closing down some of the businesses and services, and a potential for closing down some of the businesses and services not moving to the next phase. And it is certainly my objective, and I believe the objective of every other elected official. It is certainly my objective, and I believe the objective of every other elected official across the state to move forward cautiously and carefully, to have a smooth transition, so we do not have a surge of infections and hospital utilization. In our state, and again, this requires everybody in our state. The virus has not gone away. We are still in the beginning of the fight against the virus. The virus has not gone away. It will not. We are still in the beginning of the fight against the virus, and it will not. So as we begin to resume activity, we have to learn to. So as we begin to resume activity in a modified way, we have to learn to live and
to
as
work
healthy as
in a
possible.
modified way to keep
Now,
people
who
safe
are over the
and
age of
as healthy as
65 or
possible.
70, the age
Now,
depends on
people
who
who
you
are
talk
over the
to,
age of 65
and
or
anyone
70,
with an
the age
underlying
depends
health
on who you talk
condition
to.
should continue to
And
stay home.
anyone with an
And
underlying
the people
health
around
condition
them,
should
these
continue to
vulnerable
stay
people,
home.
need to make sure they
And
minimize
the people
contact.
around them,
These
these are
vulnerable people
people
need to
most
make
at
sure they
risk
minimize
for
contact. The worst of the
These are
outcomes
people
for death,
most at risk
or
for
for serious illness,
the worst of the
and long-term
outcomes
effects
for
from the
death,
virus.
or for serious
No
illness
matter what
and long-term
decision we
effects
make
from the virus.
moving forward, these vulnerable
No
people
matter
should
what
continue
decision
to
we
operate
make
under a
moving forward,
stay-at-home
these
order.
vulnerable people should continue to
The health
operate
metric
under a
that
stay-at-home
metrics
order.
that will continue to guide my
The health
decision
metric that
making
metrics
is,
that will
again, I
continue
will
to
be
guide
tracking
my decision
hospitalizations,
making
the utilization
is,
of our ICU
again, I
and
will be tracking
acute care beds,
hospitalizations, the
outbreaks
utilization of our
in our
ICU
nursing
and
homes, and the
acute
data
care
that
beds,
outbreaks in our nursing homes and the data that comes from the testing of that, and our ability to ensure clinical PPE to all of our healthcare workers and our emergency responders. If we see an upward trend in hospitalizations and we reach a high percentage of utilization of our ICU beds, we will need to reevaluate, and we will need to make sure that our top priority is taking care of people and their health. We also need to manage our nursing home outbreaks and make sure these outbreaks and potential shortages of staff do not overwhelm our hospital and our healthcare system. Since we are at the beginning of testing in our nursing homes, we do not have the data yet from this testing. That is a reason to maybe take pause and move a little bit more slowly. And we continue to have uncertainty in our supply chain of PPE, but we also continue to work and make progress on this. So PPE and testing are two of the building blocks that we need for full reopening that are not yet really truly in place yet. So today, after consultation with our health officer, our hospital, our municipal leaders, our emergency management team, and others, I am announcing the following for Frederick County, and I will be issuing an executive order that we will provide today with further details. Frederick County will implement a slower phase-in of the governor's plan for reopening. This means the stay-at-home order remains in effect with exceptions, and these are the following exceptions. For retail, Frederick County will permit curbside pickup for all retail operations. We will allow manufacturing to move forward. We actually believe that all of our manufacturers are already operating and that this really is not a change. And, of course, these are not public gathering spaces either. We will allow animal adoption. I can't read my own writing here, just a minute. We will allow animal adoption, car washes, and pet groomers to operate, which are part of the governor's order under the conditions established by the governor. We will, in cooperation with our municipal leaders and others around the county, we will allow the opening of small retail shops and businesses within our municipalities and, to some extent, outside of our municipalities under the following guidelines. All business owners must manage the number of people in their stores by stationing someone at the front door to ensure there is not more than 50% of the occupancy of the public areas of their stores. All business owners must put in place plans for keeping and maintaining physical distancing. Workers and the public must wear face coverings, and the handling of cash should be minimized. We are defining small businesses as those with less than 10,000 square feet of space. So we are limiting the opening of retail establishments beyond those that are have been defined as essential businesses, which will continue to operate. If this first step does not cause a rise in hospitalizations and we do not see an influx of patients from our nursing homes as we get the results of testing, then other establishments and other activities permitted by the government will be allowed to open for business in 2 weeks, beginning at 5 p.m. on Friday, May 29th. This will include hair salons and barber shops. And again, the rules that are put forward by the governor will apply: all face coverings by appointment only, 50% of occupancy, certain provisions for cleaning. And I am going to add a requirement that there are special hours at the beginning of the day for appointments for seniors and vulnerable residents so that we try to keep them safe, because I am concerned that as our vulnerable residents and our seniors go out and take part in some of these things, that they will be at high risk. It also means that religious facilities or houses of worship will be allowed to open again Friday, May 29th at 5 p.m. at 50% of capacity. And they will also be required to follow the state guidelines. And one of those guidelines, which we are going to make a requirement, is so I'll read you some of the guidelines. The guidelines were that churches could open as long as they maintained their occupancy at 50%. They had 7 feet of spacing between people, that they had face coverings, that there was no singing of hymns, that they took temperatures of people at the door coming into the church. And those were all guidelines set by the governor, and that there was a cap of 250 for everyone. And that cap will be something that I will make a requirement in the local ordinance. Now, we will be monitoring between now and May 29th the data from our nursing homes and the other healthcare data like hospitalizations over the next 2 weeks. So next Thursday, I will provide an update at 11 a.m. so that everyone will know where we stand. I will report on our experience with the testing in our nursing homes, that we have an update on the status of PPE, and again, whether we have seen an increase in hospitalizations. Again, this virus is still in our community, and I believe we have to remain vigilant. I believe people should continue to take this seriously, to stay home as much as possible, particularly if you are older or have a health condition. I think you should wear face coverings in public as required every time you go out. Practice good hygiene and frequent hand washing. And I want to stress that the governor continues to say that gatherings of more than 10 people is still prohibited. There will be, I also want to say there will be no changes in the operations of county government. We are going to continue to operate in the same fashion that we are now, and I really make that message to both the public and to our county employees. So I believe this phase-in is reasonable. It addresses the fact that we have not really been able to manage what has been happening in our nursing homes yet, and that we really need to see the outcome of that testing data and to see what that does before we open up further. I did want to give some certainty to some of the businesses that are delayed, that we are looking at this for May 29th. I do believe we have to open businesses and phase these things in at some point and do so carefully and cautiously. So I believe this approach is go carefully, and it's following health advice and the data that makes sense for us in Frederick County to follow. So I think if we continue to do this, if everybody continues to do their part, and we are depending on you to do that, that we can continue to move forward as safely as possible in Frederick County. So I appreciate that this is not what everyone will like, that some people wanted me to continue to keep the county completely shut down, and that others wanted to see our business activities open faster. I will say I had a conversation with some of our municipal leaders today, and while they recognize that this is my decision and recognize the difficulty of it, some of them would clearly have made maybe some different decisions than I have made. And so I do want to say I own this decision. I'll be responsible for this decision. And I really want to say thank you to all of our businesses, to all of the members of our community for doing their part and for making sure that we put the public health of everyone in our community first, and that we really do our best to make sure we don't overwhelm our health system, and that we protect those healthcare workers that we have been actively applauding. We support them and respect them the most when we make sure that they have the PPE they need, and when we make sure that we protect them from having to deal with a situation that is beyond their capacity. And even though I really thank all these people for continuing to show up to work every day, I thank all of the people that are out there assuring essential services. So with that, I ask you to be well, stay safe, follow the directives, and we will be back with an update next Thursday at 11 a.m. Thank you so much. With that, we're adjourned.
costs go up every year. The $7 million requested for FCPS will barely cover inflationary and growth-related costs. However, I fully support the county executive's budget in full. Thank you for your service to our county and supporting a sound budget. Please keep the constant rate in place. And the last one I have is